Senior health reporters Christine Birak and Lauren Pelley. You have both been ahead of so many health and medical science stories this year. We need you to keep looking ahead. Christine, let's start with you. What's your sense of what will be the dominating health story next year?
I just had a doctor tell me, Christine, these are the final days of the Canadian healthcare system as we know it. It is collapsing. Is that an exaggeration? Maybe. But Lauren and I have spent a lot of time in emergency rooms and doctors' offices, and we can firmly say that they are short-staffed and there is a flood of patients. It is unprecedented, the crush inside our hospitals, and it really does feel like the healthcare system is dangling by a thread and something's got to give. And what we're hearing from the provinces and the premiers is that give is money, and they want it from the federal government, and they don't want any strings attached to that money. Ottawa and the federal government is saying, well, listen, there's money, but we want accountability. We're not writing blank checks. We want money for mental health. If you say you're going to bring down wait times in ERs, we want to see you do it. We want to see how this money is spent. We want health data so we can fix the system as we go. And stuck right in the middle is the medical community.
So if the conversation is we need money now, where does that put the conversation about private money, private healthcare?
That is the billion-dollar question. I think that the conversations that happen and the money that gets spent is going to shape our healthcare system for decades to come. So it's about to happen, and we'll see whether that money makes our system a more equitable public system that runs better for everyone, or it'll become more of a user-pay private system that is sped up for some people, and it very, very well may depend on where you live. But at the same time, there is a silver wave of patients that we've been talking about, boomers coming into the system. We're watching what's happening with kids right now, and the system has to change. And we all want it to be there when we need it.
So the shifting demographics, Lauren, this worry about an aging population, what does that change about healthcare in 2023?
Well, let's put that in perspective. So the figures Canada is using is that the 85 and up population, that could triple in the next 25 years, triple. So that's a lot more seniors in this country, people who actually use healthcare the most. Those are the people who are the most vulnerable to issues like flu, to COVID-19. Those are people who need to have, supportive housing around them. They need home care. They need long-term care beds. One of the big pressures in our healthcare system for many, many years now has been alternate level of care patients. And that's a term hospitals use for those people where they shouldn't be in a hospital, but there's just nowhere else for them to go. So this is sort of underpinning this whole conversation is we have all these immediate pressures on the system while our population is aging. How are we going to handle that in the decades ahead is a big question this country has to answer.
Sounds like you'll be spending a fair amount of your year on that. Interesting, you said COVID-19. That's the first time this conversation it came up. It hasn't gone away, but is it going away? Is it still going to be in the headlines next year?
There's two metrics that I keep an eye on. One is COVID hospitalizations across the country, and the other is COVID deaths. Unfortunately, COVID hospitalizations are rising, not just in Canada, but also in the United States, and probably will into the beginning of next year as well. And then there are deaths, and we are sitting at about 250 Canadians dying every week still from COVID. And we're on track to hit 50,000 COVID deaths in total, probably by the end of January. So that said, and that number is heartbreaking, Canadians have done a really good job comparatively protecting themselves and protecting the people around them. But like you said, COVID is not gone. It's not going anywhere. And we really have to make some decisions. People have to make decisions about how they're going to protect themselves going forward. And that's vaccines and public health measures.
One of the things we've talked about a lot is how COVID has been an accelerator for the good and the bad. One of the good things has been the attention, the money, the research into mRNA vaccines. Is it your instinct that we're going to see mRNA vaccines applied to a range of other situations next year?
Well, that's definitely in the works. And I think when you look at just the COVID-19 situation and how vaccines helped reshape the pandemic, one physician explained to me a while ago that the severity of this disease, while still bad, while still concerning, has sort of been knocked down a peg as we've built up that immunity. So companies are now betting big on mRNA shots. Moderna is trying to develop a universal flu vaccine that would target all the known strains. Other companies are working on vaccines against cancer, everything from melanoma to cancers of the throat, the head, the neck. all of this is a long way off. You know, they still have to go through clinical trials. But if they have wins on this front, we could really have some amazing tools to beat back some really devastating diseases. Not just COVID, but more than that.
Okay, so we have 1 minute left. So just a quick whip around, something that I don't see coming, but you do next year.
Well, I think all of us have been, you know, waiting for what will be the next pandemic, right? People are so nervous after watching COVID. But for me, I'm also watching all those other known threats because we've seen everything from fungal infections to STIs come roaring back in certain ways because of antibiotic resistance. We're seeing diseases like measles and cholera and polio, some things that people have never even dealt with in their lifetime come back because of issues like vaccine hesitancy. So all of these are familiar to us. Things like avian influenza exploded this year, and I'll have more on that later this week. But that's some of the issues I'll be watching. It's not just the unknown, but it's the familiar that I think will be a big concern for us going forward in 2023 and beyond.
Can you do it in 10 seconds?
Oh gosh, variants. We never saw Omicron coming at this time last year. I want to see where variants are heading. There's great surveillance that's happening in this country. We'll have a story coming up on it because we want to know, after Omicron in the Greek alphabet comes pi. Is pi coming?
Oh, no pie. No pie.
Hopefully it's just holiday pie we're thinking about.
Oh, just holiday pie, absolutely.
All right, Christine Birak, Lauren Pelley, thanks very much.
Very welcome.
Thank you.